Welcome back. Thanks for staying with us. Deputy Minister of Health, Dr. Sibongiseni Dhlomo, has described the increase in teenage pregnancies in the country as a pandemic. Dhlomo and Eastern Cape Health MEC Nomakhosazana Meth launched a digital self-care sexual reproductive health vending machine in Mthatha. Now, this initiative is aimed at preventing the spread of HIV and AIDS and unplanned pregnancies that may lead to unsafe abortions.
The first of its kind in the country, this vending machine offers a variety of sexual reproductive health products, from birth control pills, female and male condoms, to lubricants and sanitary towels. The initiative targets teenage girls and women and aims to improve their access to sexual reproductive health and HIV prevention services. These services are accessible at the Wellness Center or by downloading the application on a smartphone. It has been welcomed by those who wish to access the services privately without visiting health facilities.
The machine is very helpful because you're going to get services privately and no one is going to see you that we are preventing, unlike in the public clinics, because in the clinics people are going to see that you are preventing, but in the machine no one is going to see you.
Since there was a lot of discrimination in the olden days that children, young girls to be specific, would get from older people, it makes it very hard for us to interact, like for us to go to in those areas like clinics to get help, like the contraceptives and whatnot. So now, since that there's this new machine, it makes it very easy for us, and we appreciate it kakhulu.
The health department says teenage pregnancies are prevalent in the OR Tambo area. Statistics show that in the past 2 years, close to 12,000 girls between the ages of 10 to 14 fell pregnant across the country. The department expressed shock that girls as young as 9 also fell pregnant.
These are our efforts as the Department of Health to say, more than listening to young people who say, but Dr. Dhlomo, not all your clinics are very friendly to us. We go there reluctantly because we need a service. Hence, they educated us to start programs called youth zones, where we have a nurse, at least who's friendly to young people, who's non-judgmental, able to assist them and support them. And we have seen an increase in terms of uptake of such services.
We are here in OR Tambo, a place that we know that there is a high number of HIV infections, there is a high number of teenage pregnancy, and these services, the sexual reproductive health services, are most needed in this district. So this machine, that is the first machine of its kind in the country and in the province, coming here to this area is very strategic for us, because the area we are at is Ultra Seed Shell Garage, which we are partnering with to give services, in particular looking at sexual reproductive health services, because truckers, they park here and many schools are around this area.
International partners have come on board to support the initiative. They also expressed concern at the rising numbers of HIV infections and teenage pregnancies.
We see it as a pandemic, we see it as a critical part of our program, and what has been really interesting in South Africa recently, in a recent household survey, the SABC survey that was conducted and supported by the Centers for Disease Control in South Africa through the HSRC, the decline in the Eastern Cape province was, you could see the decline from 1 year, from the 4 years to the next, when the next household survey was conducted, and we are really encouraged, but there's a lot still to do, and teenage pregnancy is a critical issue.
This is really the right thing to do. As a WHO, we issued a global recommendation of making sure that we bring reproductive health services to young people to closer where they are. So South Africa, and particularly OR Tambo district, has really set an example. Very few countries actually have such kind of services. So this is the right way to go. And WHO, we have been working very closely with the ministry to make sure such services are really brought closer to the young people.
The second vending machine will be placed in the Nyandeni area. Fundiswa Mhlekude, SABC News, Mthatha.
Now, Deputy Minister of Health, Dr. Sibongiseni Dhlomo, joins us now to expand on this discussion. Dr. Dhlomo, a very good evening to you. Welcome to the late edition, and thank you for your time. I mean, a vending machine, first of its kind in South Africa. How does it work?
Thank you very much, and good evening to you and to your viewers. No, it works in the way that there was going to be a call. Any client will then make a call to a number that is inserted there. I can't remember the number now. That caller is going to go to a call center of Seoul City, and there will be a healthcare worker on the other side who will interact with the caller as to say, who are you, what service can we help you, and ask you various questions related to health. Have you had this for the first time? Are you allergic to anything? And therefore, at the end of the discussion, there will be an agreement that, yes, indeed, I do need a female condoms or male condoms. I do need trifasal oral contraceptives, or I do need Nodet or whatever. And then you will then be given a code that you can do sitting in your own sofa at home, out of school, walking in towards this center. And then you then get a code which you are going to punch into this machine. There's an open space there where there's a number. Want to type it, you go into an ATM, punch that number, and then whatever that has been talked about, consulted through, will then be dispensed there, and you can then have it and then use it as and when you actually do. And this is actually, we are saying again, is an add-on, not a replacement of what we already have, but it's going to really accelerate the access of young people into these sexual and reproductive health services, which they need so much, and which we really wish to really make them available to all of them. As you see there on the picture, that young person was demonstrating, was able to dispense a packet of sanitary pads, and therefore that also is available from this machine.
Dr. Dhlomo, a lot of the young people that SABC News reporters spoke to about this in reaction to all the excitement, but what really stood out is the discrimination that young people speak of, saying that going to a clinic or a health facility has been hard because they can't really talk to the healthcare worker, they get judged and all of that. And that has been a barrier of access, which is why perhaps I believe it brought you to this idea. How are you going to ensure that the healthcare workers on the line don't send across the same message to these young people who are shying away from visiting healthcare facilities?
There is a program that we have embarked on called Youth Zones. Youth Zones is a facility, a health facility that has got a nurse, usually younger nurses who have been oriented, trained to be not to be judgmental to young people, who is actually going to be very friendly to them. We have 2,700 of these facilities into the country. Young people do give us feedback, and they're actually accessing those services there, where they do not go into the same queue with the elderly, with the other people who are coming from for other programs in the clinic, but young people accessing their services. So this is like what I'm saying today is an add-on. We already have established such. We need to accelerate and make all our facilities youth user-friendly. One nurse who's not judgmental, able to assist. So that is something that we have learned from young people through dialogue to say, but we would wish to access these services. Not all clinics are youth user-friendly. So while we really are working on to make sure that, yes, they still use our clinics, those where there's a sticker saying youth zone available services in this clinic, we now add on with these vending machines. So we really are keen to make sure that we talk to our staff members, improve the attitude towards young people, and make sure we really give them these services that they so need desperately.
With these services that are so desperately needed, could there be an instance where a young person is denied the code and perhaps encouraged by the healthcare worker on the other end of the phone to rather abstain and wait? Is that going to be something under discussion when it comes to some of the prerequisites in accessing that code?
there would be, there shouldn't be such a situation where the person is denied, because that's what we are even talking to some of our staff members to say, don't you think that this young person is responsible enough, young as she is, 16 and a half years old, 17 years old, to come to our facility and say, I am sexually active now. I do not want to fall pregnant before I finish my matric. Please help me. So we then are saying to ourselves, that is a big responsibility for the young person to take, to say in her busy schedule or in his busy schedule, he or she comes to a clinic to talk about these issues. So that's assist rather than judge. So I don't think on the other side, the caller will be actually in that space of discouraging and not actually giving the service. Even if live physical visits to clinics, we even encourage to say there's been an effort done by this teenager. Let us assist, because next time this teenager is going to be pregnant and they will have an unwanted pregnancy. Let us assist, because there are still those who are really abstaining, and we really commend them for those processes. But some of those who have really moved into another stage of sexuality, we need to assist them. There's no way we can wish them away, because we want these young persons to finish matric before they can fall pregnant or have an HIV infection or sexually transmitted infection. So it's our responsibility and our duty as a country, as we invest in young people through education, to also prevent them in really falling off and become losers in terms of accessing health services.
And very lastly, Dr. Dhlomo, before we let you go, which other areas will you be looking at insofar as placing your next vending machine?
As we are piloting it, ma'am, we have 10 of these machines into the country. There are 2 that are also going to be sent to Mpumalanga province, Northwest province, Northern Cape, and therefore the leaders in those, our MECs, their colleagues will then decide. Some of the 2 others will go to KwaZulu-Natal as a pilot program, getting a feedback in it. Of course, we are looking for more other support from other donor partners who can then support us. Like we were today very happy that the WHO was part of us, and they commend our country being the first country that is actually doing this program. So we think many of our partners will support us to add more of these machines as we are going to be piloting and seeing the results, which is very confidently, and young people are saying very privately, confidentially, I am able to access outside the space of my grandmother, my mother in the clinic. So this is really a way to go to add on to these services that we really think we must encourage to young people. So for now, we have got 11 in the country, going to be going to 5 provinces, 2 per each, and then take it from there in terms of the success of this pilot project.
All the best for that initiative. Let's leave it there for now, and thank you for your time. Deputy Minister of Health, Dr. Sibongiseni Dhlomo, talking to us about a first of its kind, a self-care sexual reproductive health vending machine launched and being piloted first in Mthatha.